Umi Motewane has breast cancer. She says doctors at a public hospital close by can't help her.
They tell me that they don't have medication. They're just going to give me Panadol, Brufen, and then, or sometimes they just put me in oxygen after that discharge.
According to the Cancer Association of South Africa, more than 100,000 South Africans are diagnosed with cancer every year. Public health facilities across the country can't manage the numbers. This is the nearest hospital in the area, but it doesn't have an oncology department. Cancer patients have to go all the way to Johannesburg to get the drugs, but then not every hospital has them. That's partly because drugs in South Africa are often expensive, and state-run hospitals have no or limited supplies.
Now, how many women and men out there that died, meanwhile they could have get Herceptin, and they couldn't, and it was the only drug that could have prolonged their life so that they may raise their children, for God's sake.
Countries like India and Argentina use the safeguards outlined in international law to limit the number of drug patents that are granted, but South Africa has yet to do that.
The patents are mainly being granted to international drug companies who want to protect their patents in this country. And it means that South African-based companies, which are mainly generic companies, can't come to the market on those drugs for a longer period of time because they're waiting for those patents to end.
The government has a draft policy that could make drugs easily available and affordable. The Department of Trade and Industry says Cabinet is working on fixing the patent laws. The issue is agreeing on a consensus.
There are some other issues which would not benefit the pharmaceutical companies, although they would benefit the generic industry and vice versa. So I think a lot more attention has to be given to this draft IP policy, especially the wording, so that there is no incoherent understanding that comes from it.
Cancer patients like Umi and Reynolda hope an agreement can be reached quickly. They need affordable drugs that could save or prolong their lives. HARU, MUTASA, Jazeera, Krugersdorp, South Africa.